Hey guys, Don here. Welcome to Podiatry Practice Mastery, where I'm helping you get your practice to the $1 million mark and beyond. I am looking at, this is one of my favorite books of last year, 2025. It's a book by Alex Hormozi. It's called Money Models, and there's specifically one money model in here. It is, if you get the book, you can look it up. It's page 77. It's called Menu Upsell. So let me kind of tell you how this kind of works in my practice. What this is, it's a menu of items. Basically, like if you go to a store and there's a menu, and there are things. So what the menu upsell is kind of what I've realized that I developed even before I read about this. It's called my treatment sheets. So if you don't use a treatment sheet, I think it would benefit you. Because currently, like I guess what I used to do is I used to say, okay, you need to do this and this and this. You need to do night splint, foam rolling, morning stretch, and it kind of complicated it for patients. Like they forgot what I said, they got overwhelmed by everything that I was offering, they got overwhelmed by everything that they saw online, and it was kind of a challenge for my patients. And so then what I found out worked best is what Alex calls a menu upsell. So let me explain. Imagine I have both called a treatment sheet in my pocket, which is a generic one that has some of the most common treatments that I do on the sheet, or the menu of treatments, I guess you could call it. And I put them in categories. I say, okay, you have things that can reduce inflammation, you have things that can reduce tightness, and then you have things that can help reduce strain and stress on your foot, like such as shoes, anti-inflammatories, or orthotics, shockwave, things like that. And then I've kind of gone a little bit further, and I've made these treatment sheets which have them kind of divided based on diagnosis, and then now I'm kind of phasing into what I call phase 1 and phase 2 type of treatments. But what he talks about, and I want to kind of explain this from his book, a menu kind of a menu of treatment is you kind of first go and explain everything to the patient, kind of what they have, kind of why they have it. And you, once again, as I talked about this before, you sell the vacation. Okay, what would it be like if you could walk without your heel pain? Oh, that would be great. Okay, and so let's talk about the treatments. So what he says here is there are some things you do. First, you can unsell what patients don't need. So many times, even before I talk about what patients need for plantar fasciitis, I'll say, on the sheet you see this MRI. I crossed it off. I don't think you need an MRI. Surgery. I don't think you need surgery, so I cross off surgery. A brace, you don't need a brace. Walking boot, you don't need a walking boot. So I cross off the things that they don't need. The second thing is I say, okay, well, I can prescribe what they do need, or even I can say what things they can get somewhere else. So for example, we have foam rollers here. I'm going to recommend foam rolling. You don't have to get ours. You can probably have one at home, or you can just get one somewhere else. That's fine. So I want to pick which of these items that I want them to use that I have. So some of the lower value items that they can just get, or they might have at home, they can do that. You have shoes, you probably have your own shoes. These are the ones I recommend. If you have your own that are this brand, that are a good brand, you can do this. So that's first, unsell, or tell them what they don't need. Then I prescribe what they do need. And the way I do this now is I do with phase 1 and phase 2. Phase 1 tends to be the things that insurance covers. I say most people want to start with the things that insurance cover. We can start with these things, see you back in about 3 weeks. If it's not getting better, then we'll go to phase 2. And so phase 1, for me, it always tends to be like an anti-inflammatory, contrast bath, morning stretch, foam rolling, night splint, things like that. Maybe an over-the-counter insert, or these types of things are phase 1. And then phase 2, I'll ask them, or I'll say, okay, we'll do an ultrasound, and then we're going to go to phase 2. Now, what he talks about is something that I'm not as good at yet, but I like the idea of it. So phase 2 is where when they come in, I'm going to say, okay, we have shockwave. Okay, would you like to do it once a week, or would you like to do it every 3 days? So research shows that you can do it every 72 hours. So what he calls this is called an A/B choice. So you give them 2 choices, not if they want shockwave. You say, okay, how do you want to do it? Do you want to do it once a week, or do you want to do it every 3 days? So a lot of my athletes, they want to do it every 3 days so they can get in and get it done. So that's an idea of an A/B option. Another way of doing an A/B options is like an amniotic stem cell injection, and we're going to do an amniotic stem cell to help your tissues to heal faster, give them the building blocks to help heal. Most of my patients do that visit 2, but you can theoretically do it visit 1, 2, or 3 But just know that it takes time for this to start working in your body. And so the sooner you do it, the better. But most of my patients do 2. Which one would you like? And so a lot of times they'll choose, okay, I'll just do visit 2. And then the last thing would be orthotics. So the A-B choice for orthotics are, you don't want to ask them if they want over-the-counter versus custom. What you want to ask them is say, okay, most of my patients do orthotics week 3, because that way they'll get them the last week and things are going to be starting to feel better. But you can do it at any time. You can start that right now, and then they'll be better, be ready in week 3 when you're back at your 3rd shockwave. But a lot of times when the tissue is inflamed, it's not going to feel real good, but you can start it whenever. And so these are ways for us to kind of offer A-B options, and so instead of saying yes, no, they want it, they're going to say, okay, they're going to choose which one that they want. And then I say, by the way, they're going to schedule these for you. There is a little bit of discount if you prepay. Why do we do the 10% discount when they prepay? What I found with discounting, I don't tend to discount, okay, ever. But what I find is for convenience, it's easier for my staff to set up all 6 appointments and even set up the the amnio and the orthotic scanning all on one visit. So it saves me time. So for me, it's worth it to give them the 10% off. Secondly, by giving the 10% off, I have all this scheduled, and they're more likely to finish the total amount of treatments. Some patients, they want to do piecemeal. They want to do piece by piece. Usually those are the ones that aren't really believing what the process is. So this is called the upsell offers on Menu Upsells with Alex Hormozi. One thing he talks about, which I don't really do this, but he talks about having a credit card on file and just say, hey, would you like to use the credit card on file? But for a lot of these, and actually for the first time ever today, the patient didn't even ask me the price. And I know some doctors don't even go over the price. They just let the staff. I tend to go over the price, but here it doesn't ask anything about price. It just says, okay, this is, if you want to do this, we can put this on your credit card. And it's hard. I want to be clear. Like getting used to something that used to be, let's say, $1,500 for the shockwave, and now for me is like $3,600. It's a jump in my confidence level in doing this for patients. So I almost have to watch myself when I'm doing this, because it's such a different game. But I think this is the game we have to get to. This is the level that we have to get to, and the confidence that we have to get to, that this is going to get our patients better. And no matter what you're going to be doing, whether because it's always been shockwave and orthotics, but in the past it wasn't as maybe I didn't believe enough in it to do it. But now as you get better at explaining it, and I think using this menu upsell option will help you with this. So anyway, you should read this book. This would be a good book. If you don't want to read the book, I would even maybe go into ChatGPT and say, like, give me tips on Alex Hormozi's Menu Upsell. You might be able to get some initial tips in there. I know he doesn't give everything away in there, but there are some things. Okay, so he gives a couple of examples in here. Like I think I told you about, he gives I like his examples here. So one would be, for example, a massage therapist. So you unsell what they don't need. You could say, okay, we could do lymphatic drainage, but I don't think you need it because you're not pregnant and you're not going to have surgery, right? And so that's how you unsell that. So for us, I don't think you need to do surgery and things like that. Prescribe. So we're going to do this for you, and then A/B. Which one would you like to do first? Do you want to do it once a week? Or do you want to do it every 3 days? So these are the ideas. Look it up. Let me know what your thoughts are, and we'll talk to you tomorrow.